Described as the worst case of flu that you could imagine. From fever to chills to upset stomach, nausea, vomiting, diarrhea, body aches, shaking, the whole bit.
It's all of it.
So you would try, you would get horribly sick, and then just say, "What? I can't do this. I've got to get back on the drug again."
Because there was no real treatment for you to get off of it.
Right.
I mean, you go into rehab and that's just kind of like a detox center. You know, you go in, you dry out, and then you're out back on the street.
One of the problems with rehabs, and I agree with you, is that many folks will go into rehab and they're clean in rehab, but they get out and they're back with the same friends, the same stress, the same availability of the drug, and within a few weeks they're right back.
Yeah.
Did you ever go to rehab?
Yes.
You did. How many times?
Twice.
And exactly what I explained. I mean, you would go, you would get clean. How did you feel when you came out and you were feeling like you wanted to start using again?
I mean, I would say to myself, okay, well, you know, I'm going to go this way, I'm going to do it straight, I'm not going to do anything. And then you have friends that,
so-called quote-unquote friends.
And it's
yeah. I tell you what, hold on for 1 second. We have a break coming up. I want to get back to this when we get back. So we will be back with Brandy. We'll also have some interviews with folks on the street with our reporter, Catherine Shreve, coming up after the break.
Coming up on Tell Dr. D.
Some very powerful stories of addiction from the streets of Atlanta. Some of them tragic, but some of them also inspiring. And we really couldn't believe some of the things that people have been willing to share with us on camera about what addiction has done to their lives and to the lives of their loved ones. America Speaks About Addiction when we come back. Stay with us.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women, a special place that understands your life. We are Memorial for Women.
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, Behavioral Health Group's Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
I don't really know if I'd say I have an addiction, but I don't know, I do a lot of drugs and I have since I was like 14. But I don't know, I've had like a lot of different drugs of choices. First it was weed, then I did coke for a while, and then it was acid, and then like a lot of designer drugs, and then I did a lot of like cough syrup and stuff.
Pretty much more of anything that would make me high. I mean, that's how it worked for me. You know, it didn't matter if it was, you know, liquid or snorted or whatever. Got clean when I was 19 and got very involved in 12-step program.
I fought through the dungeons of addiction for a long time. Started out as a dealer of the poison, you know. But the dealing of drugs caused you to like break down whole communities, whole families, you know. I started out, I had a guy tell me this. This is what he told me. This is what changed my life in the drug business. He told me, he said, when you first got here, this is a city that I was dealing in. He said, when you first got here, you had so much class and so much charisma. Now you're just like the rest of them. Yeah, and it crushed me. It broke me down because I prided myself on being different.
What are some of the things that addiction has caused you to do to yourself and your body?
Man, my cutting addiction, I have over 200 scars on my body from it. You know, I have cigarette burns. I have, like, all up here, all here, all up and down here. Just years and years of scars, and each one has a story, and I can point to each one and tell you exactly how I got it and what mindset I was in when I put that there.
Welcome back. For those of you just tuning in, my guest is Brandy Emmons, an incredible individual telling us her story of addiction and recovery. And Brandy, we just saw the Man on the Street interview, and I wanted to get your take. Obviously, we have a young man there who said he's been doing drugs from 14 to 19, but doesn't really think that he has a drug problem. What do you think? Yeah. And I think that that's an important point that I need to make here, is that we call it chemical dependence. So if you go from marijuana to narcotics to cocaine to speed and think you don't have a problem because you keep switching drugs, you are addicted to the chemicals, not necessarily one drug, even though you could be. So I think that's an important point. And then also we had the other lady who was talking about the 12-step program, and I would sure that in your recovery process you probably got involved with that at some point?
No.
Never did. When you went to rehab?
No, I didn't.
Oh, that's fascinating.
And then here now, I didn't do
Well, we'll get to your treatment now, but I will say that the 12-step program, of course, will be Alcoholics Anonymous, Narcotics Anonymous, and still in many areas is a mainstay of treatment, very therapy-oriented, but a fantastic treatment choice. Typically, when you go through rehab, though, the 12-step program is a big part of that, so that's...
I think I went one time, and I don't know.
So were you supposed to go and just didn't like it?
No, it wasn't. I mean, they recommended it. They
Right,
recommended me to go, and I was like, okay, so I would go.
Right.
I went one time. I got all the stuff, and I read through it, and I thought, I can do this on my own.
Right.
2 weeks later.
Not. Okay. So you went to rehab twice. What was it like after the second time? You came out, you relapsed again. What were your thoughts about your life going forward at that point?
After I came out the second time?
Yes. You'd already tried it once, you tried it twice, you relapsed both times.
I just gave up. I was like,
you
well,
just-
you know, I guess this is how it's going to be. You know,
A narcotic addict.
Yeah, because
Okay.
I didn't know any other way to stop the craving of wanting to take the pain pills or anything else. Because if you couldn't find pain pills and someone had, say, OxyContin, then you buy the OxyContin because that was going to keep you from getting sick.
How did you feel about yourself during that time?
I hated myself.
Yeah.
I hated myself.
Yeah. I mean, was it the point where you knew what you were doing, you knew it was wrecking your life, and yet you felt like you had no control?
Yeah, I just didn't. I mean, it was miserable.
Did you get depressed?
Very depressed.
Yeah. Ever get treated for that?
No. Well, I did, but I didn't want to take the medicine at first, and
obviously the medicine really wasn't going to help if you kept taking the narcotics. Yeah.
because I mean, I did get on some things. I was on Cymbalta for I guess the doctor said I had it was an antidepressant, and then
Right.
I had trouble sleeping at night.
So you took
because
a variety of things.
Yeah.
Did it ever get so bad where you had thoughts of suicide? Yeah.
yes.
Yeah, which I will say is very common with the narcotic addiction, especially when folks really want to get help, they want to get clean, and they just can't do it.
Right.
They don't know where to turn.
And no one understands if you've never been there and you've never walked in, say, my shoes, you don't know how I feel.
As they say, never criticize another unless you've walked a mile in their
Exactly.
shoes. And obviously I've treated enough narcotic addicts in my practice to know that the majority of them do not want to be taking this drug. They have been through the time where it was fun and they got high and all that. Now they just take it to keep from getting sick,
Yep.
and their self-esteem is shattered, and they're